Brandon Ingram of the Los Angeles Lakers has missed a couple of recent games because of, at the time, what was an unknown injury to his right shoulder. The coaches and staff had no idea when he had sustained the injury, but we just found out today, unfortunately, that he's been diagnosed with a DVT, or a deep vein thrombosis, essentially a blood clot in his arm. What's up, everybody? Welcome back to the channel. For those new, my name is Brian, and I'm a doctor and a sports fan, and it's my goal here to combine those two interests to help look at sports injuries and sports medicine topics to try and teach you guys a little bit more about what might be going on. Today we're going to be talking all about Brandon Ingram and the blood clot that we just found out he has in his arm. Specifically, we'll review what a blood clot is, how a person can get them. We'll talk about what the treatment is going to be for someone like Ingram, and then last of all, what the effects could be on his career. And I'll tell you, there's some really kind of concerning and important things that the doctors are going to have to look into that could really affect the rest of his playing health. As always, please subscribe if you want to see more of these videos, and let's get started. Let's break down the word first, deep vein thrombosis. So on our body, we have our superficial veins and our deep veins. The superficial veins are those ones that you can see kind of bulging on your arm after you've been to the gym, and the deep veins are the ones that are much bigger that you can't see from just the skin. We have a number of bigger veins in the arm and a couple that run up under the armpit, and all those veins are returning blood back to the heart. That blood then goes to the lungs, back to the heart again, and then pumps oxygenated blood through the rest of the body. For various reasons that we'll discuss, the blood can clot in those veins and then hopefully just stay in the same spot, but sometimes a piece can break off and go to the lungs, causing a pulmonary embolism. Of course, this is a similar story to what happened with Chris Bosh, and we all know where that went, so go check out the video I did on him here if you want to see more about that story. But what exactly do we think about for the cause of a DVT and just the average person we see in the hospital? There's three things to talk about here, and it's this idea of what we call Virchow's Triad. This was named after a guy who lived a long time ago, and it's basically the three things that predispose somebody to blood clots. Sometimes people have hereditary conditions where their blood is more susceptible to clotting, and so there's different hereditary disorders that we always test for in people who have spontaneous blood clots. So in the case of Ingram, I'm sure they're going to test to see if he has any of these genetic conditions that would predispose him to clots. The second thing is any sort of injury or damage to the blood vessel wall. This would be from things like trauma that could happen that would cause irritation in the blood vessel wall that would predispose you to a clot forming. Certainly in a basketball game, you're getting hit, it's rough, but that really isn't enough trauma to cause a blood clot to form just in the arms in someone like this. And then the third thing that we think of in that triad is poor blood flow or blood stasis. So this is the classic story of somebody who gets on an airplane, they're sitting on a big cross-country flight, and then they start to get some shortness of breath, and we find out they had a blood clot in their leg that went up to their lungs. This is a lot more relevant for someone with a blood clot in the legs, which is much, much more common. Like a very small percentage of all deep vein thromboses are actually in the arms because we use our arms, we're moving them around, and so there's really not an opportunity for the blood to become stuck or staying in one spot. So really, of those three things, like nothing seems to particularly fit here with Ingram unless there is some genetic kind of disorder that predisposes him to clotting, which is, I'm sure, something that the medical staff are going to look at to try to determine. If those three things we talked about before don't really line up with anything that's obvious in the history of someone like Ingram, what else could be going on? There's an important thing we think of in any young person who gets a spontaneous blood clot in their upper extremities or in their arms, called just a primary spontaneous upper extremity DVT. There's a couple of other names for this. Some people will call it an effort thrombosis. Then there's a big fancy name called Paget-Schroeder disease that you can see some research on. And the population that we see this happen in is exactly someone like Ingram. It's a young person, typically with a lot of muscle, they're an athlete, and it's someone who is doing a lot of repetitive overhead tasks with the arm. And so imagine right-handed shooter, shooting a basketball day after day, doing weightlifting day after day. That repetitive motion is part of what subjects people with this specific diagnosis to a blood clot. Now again, I'm not saying this is 100% what he has, but it's something that the doctors are going to have to think through and evaluate for his long-term health. The reason why that movement matters is one of the main big veins in the arm is called the axillary vein, and it runs deep in the armpit. From the armpit, it goes up into the neck and then down into the heart. If you've heard of the idea of thoracic outlet syndrome, we talked about it with Markelle Fultz that I'll link here, but it's essentially when you get compression of the nerves and the vessels that run through the neck and down into the arm. They can be compressed because the muscles are too tight, they can be compressed because you have an extra rib, or they can just become compressed because of some repetitive motion that causes pinching. And so if you have a situation where the vein running through that thoracic outlet is already susceptible to being pinched, and then you pinch it even more by bringing your arm over your head, That repeated pinching, that repeated stretching and trauma is what predisposes these specific conditions to getting blood clots, and it's in the vein there in the shoulder, and so that would be why someone would have shoulder pain. You would treat it the same way initially that you would treat a blood clot that's deep down in the forearm, but then you have to think about what else might be going on in the thoracic outlet or in the shoulder that could have set someone up for this type of injury. You have to think about what might be going on the other side as well, because typically people's anatomy is pretty symmetric. So after you treat someone and do that initial assessment, then you've got to go figure out if there's any sort of structural problem, such as a thoracic outlet syndrome in the shoulder and neck, that's causing this and could make it happen again. So again, I don't know if that specifically is what he had, but it's going to be a part of the plan and part of the workup, because if there's something else there, you've got to know about it and you've got to treat and act on it, because otherwise you're going to be just as susceptible to a blood clot forming again down the road, and then you're potentially on lifelong blood thinners and you run into the question like we had with Chris Bosh. Let's talk next about treatment. So it doesn't matter if you've got a blood clot in your leg, in your arm. The guidelines is that you treat with a blood thinning medicine for 3 months, and these can be pills that you take on a daily basis to help try to thin the blood, stabilize that clot, and then hopefully let that clot resolve. The big thing we're trying to do is prevent that clot from getting bigger, because as I said, all the veins eventually go back to the heart and then the lungs, so if a piece of that blood clot breaks off, it can travel and block the lungs and cause a pulmonary embolism, which can be much more serious and potentially deadly. And if you remember in the story of Chris Bosh, this was really the reason why the doctors wouldn't clear him, because he had to stay on these blood thinning medicines. Whenever someone has a clot one time and we're not really sure where it came from, most of the time we can just treat for 3 months and then you're done. It's whenever you have recurrent blood clots that you have to be on much longer, potentially lifelong blood thinning therapy. So at a minimum, someone like this who gets a blood clot in their arm is going to be on blood thinning medicines for at least a few months. And so that's really the main reason why he can't play, because they're not going to let him play on blood thinners in case he gets hurt and has any sort of catastrophic bleed. So I mean, it's crazy. It's nothing that an athlete did to themselves to cause them to have this happen. It's nothing a person necessarily does to themselves to cause a blood clot to form, but nonetheless it happens, and it's great that the doctors were able to do the tests and the ultrasound to pick up that that's what's going on, because if they miss it and he goes out and plays, that blood clot could break off and go to the lungs and be deadly. So it really is fortunate for him that they at least caught it before anything worse happened, but unfortunately means at least he's going to be out for this season and be on blood thinning medicines, and then they're going to have to do a lot more testing and workup to see if he can play again, when he can play again, what sort of stuff they're going to have to do to make sure that something like this doesn't happen again. This isn't about basketball anymore for him necessarily. While certainly they want to get him back to the court, it's about just his general health and well-being. You can't have someone walking around with blood clots forming in their veins, because it could ultimately be deadly. So I really wish him the best. I hope they're able to get this treated well. I hope it resolves quickly and that there's no structural stuff going on in his shoulder, so that he can ultimately come back to playing, because it certainly is a possibility. I'm sure we're going to get a lot more information about what caused this blood clot, what else could be going on, what his treatment's going to be, and that'll shed some more light down the road in terms of what to expect for the rest of his health going forward. So that's it for the video, guys. I hope you learned something more. Like I said, try to think of it just from his own health and well-being. I know it really stinks if you're a basketball fan to see him not be able to play, but this is one of those things that crosses those lines to be more just about his overall health and life. And so I'm glad they found it now. I'm glad nothing else happened, and hopefully they'll get it wrapped up pretty quick so that he can be on the court next season ready to go. Thanks as always for watching the video, everybody. Let me know if you have any questions or comments below, and we'll see you in the next one. Bye.